Hi, everybody, and welcome back to the gastrointestinal physiology. We were talking about the motor function of the GI system, and we discussed the motor function that we have in the esophagus, in the mouth, swallowing, chewing, and esophageal movement. Now, food enter the stomach. You know that stomach is a dilated part of the gastrointestinal tube. In fact, we can say that it has the same principles, except that in this place, in this part, the tube is dilated and has the ability to dilate even more. Therefore, it brings us a capacity to reserve the food, large scales, large amount of food inside the GI system, and then gradually release it into the intestine. Therefore, the motor function of the stomach is not just passing the food from the stomach into the intestine. It has other function that we should discuss about them. One of the motor function of the GI of the stomach that I told you is very important for us is the storage of large quantities of the food, because of the dilation that it has, because of the capacitance that it has. You remember I told you in other classes that you had in other semesters that capacitance means how much of volume we can add to a chamber, to a part of the tube, without increasing the pressure, or with lowest in pressure change in that tube. And stomach, because of the motor function, because of the smooth muscle that are able to relax and allow a large quantity of food to enter it, is able to store this large amount of food. You know that this help us to have a long period of time between our meals, because during this long period of times, this food that is reserved will be released gradually into the small intestine, and gradually over 1 to 2 to 3 hours to be absorbed, and therefore we have a continuous supply of food for us in our stomach. You know that in other animals sometimes this function is even more potential to provide the food for a longer period of time. But for human, it is one of the motor function of the stomach. Another motor function of the stomach that is very important here is the mixing of food with gastric secretion. Because I will tell you in the secretory function of the GI system that stomach and gastric mucosa is the most important part in the secretion of the gastric juices, acid, enzymes, and these very important secretion that gastric mucosa has should be mixed completely with the food content. And this is not possible without the motor function of the stomach. And on the other hand, the stomach has a grinding function. I mean that it has a function like the process of chewing, and this process allow the food even to become even more and more soluble, more and more liquid, and less and less and short, very small piece of food will be produced. In fact, when food enter the stomach is semi-solid, but when it exit from the stomach is semi-liquid, not semi-solid. And this is another motor function of the stomach. Finally, one motor function of a stomach that should be mentioned is the slow emptying of the chymus, that it means the content of the stomach, into the intestine. This is very important because, you know, if the content of a stomach was going to empty it into the intestine suddenly, it was extremely dangerous and sometimes even even can cause a cardiovascular shock or osmotic shock, because you know that stomach contain a humus that is hyperosmotic, and this hyperosmolar content is able to absorb large amount of the fluid from the blood, and this can cause a syndrome named as stamping syndrome. And because of the slow emptying, this process is not happening. On the other hand, humus is highly acidic, and sudden release of the acid content into this intestine could be dangerous again. And for this reason, a slow emptying is important for us. When we want to talk about the stomach functions, we should classify different parts of the stomach. And as you see, we can say that lower esophageal sphincter and the area that is near to it is named as cardia and lower esophageal sphincter. This part has the function to prevent the reflux. I told you that lower esophageal sphincter do not allow the reflux of the stomach content into the esophagus. On the other hand, it regulates the process of belching when some gas is being trapped in the upper part of the stomach. This part allows the return of this gas into the mouth, and this is another function for the lower esophageal sphincter and cardia that everybody knows about it. I'm not going to discuss about the secretion, but you should know that in the middle that this part have a secretory function, such as secretion of mucus, bicarbonate, and so on. The main part of the stomach is named as fundus or body. And as you see, the fundus or body is the main body of the stomach that is involved in the reservoir function of the stomach. This part is able to relax and accept large quantity of food. This part is able to contract and generate enough force to empty the stomach into the intestine. Therefore, this part has the motility and motor function. And as I told you, and I will discuss about in other sections, that this part is also very important in the secretion of different enzymes, different factors such as acid, intrinsic factor, and enzymes. Finally, we have the antrum and the end part of the stomach that is named as antrum, and the one another sphincter. This sphincter is named as pilor or pilorus. This pilor sphincter again has the principle of other sphincter. Normally, it is contracted. When it is stimulated to pass the food, it will relax and allow some content to pass, and then again will be contracted. In the antrum and the pilorus, therefore, the motility mainly is regarded to mixing, grinding, and some function like sieving that allow the liquid content to pass and the solid content to reject it again, or resending back into the fundus to be mixed and liquefy. These are the motility function of the stomach that is summarized in this table, and I ask you to please read this table very carefully. What about the grinding or grinding function that I told you we have in the pyloric and pyloric part of the or an antrum part of the stomach? Imagine in this figure that when the body is containing large particles, such as this yellow particle that you can see, As you see, these yellow particles um, uh, are a little large. These are pushed into the pyloric part, but pylor sphincter is completely closed. Therefore, gradually the pressure in this part will increase. Why? Because the pylor is closed. And when the pressure is increased in this area and this wave of contraction is moving forward, while this pyloric contraction do not allow the emptying, pressure in this part will increase. And when pressure is increasing, the high level of pressure will reject the content back into the antrum with high pressure, and this high pressure movement make the particle smaller and smaller. Imagine this process is happening several times. With each cycle of contraction and rejection that is happening, we have a process of teritoration. And this teritoration make the particle smaller and smaller to that point that it become completely or semi-completely fluid. When it become fluid, then the pyloric valve will be slightly open and allow some of this content to enter the duodenum. Not all of it, just a little amount of this content to be to exit from the stomach and enter the duodenum. And then again, the pyloric contraction will prevent the other phases to happen. This process will repeat again, and again over some minute and some hour. And over the course of this several minutes and several hours, gradually the content of the stomach will be emptied into the duodenum gradually, and when it become completely fluid. By this figure, therefore, you understand that even the stomach contraction not only mix the food, but also it make it smaller and grind the food content. Okay. These chimus that is formed by the function of the stomach then will be emptied into a duodenum. And duodenum, I will tell you that duodenum is regulating how much of content should enter the duodenum. I mean that the duodenum itself is involved in the regulation of the motor function of the stomach. Except this movement that we have in the stomach during the food presence in the stomach, there is another contraction that is happening in the stomach, but this time at the time that stomach is completely empty. This is named as hunger contraction. What is hunger contraction? You may, all of you, have this experience that when you are hungry and you are starving for example, about 16 hours, 12 to 16 hours, then you will feel sometimes painful contraction in your stomach. At this time, it generates pain because it is very strong, and this causes a little ischemia and causes the pain. This hunger contraction, in fact, is not because of presence of the food. It is because of absence of the food, and it generates the pain that we sense when we are extremely hungry. What are the factors that regulate the stomach movement and control stomach emptying? I can say that several factors are involved, including the gastric regulatory mechanism itself, the hormones, and also the enteric nervous system, and even autonomic nervous system. All are involved. For example, when food enter the stomach and it stretch the stomach, it stimulate the contractility of the stomach by itself. It is a local regulatory mechanism. Or it stimulates the release of a hormone named as gastrin. That you know that gastrin mainly is released by the gastric mucosa, and also some by other parts such as the duodenum. Gastrin itself is a hormone that stimulates the contractility of a stomach. On the other hand, as I told you, the duodenum is also a regulator for the contraction of a stomach. Mainly, this regulatory function is inhibitory, but sometimes it may be activatory, but mainly it is inhibitory. What are these effects? These effects are mainly enterogastric nervous reflexes that is started from the duodenum back into the stomach. For example, when the duodenum is stretched, it means that a stretch received a high volume of content, and now it has not enough acceptance of enough of another content. When the duodenum is stretched, it will inhibit the gastric contraction. It inhibits gastric emptying. In fact, let me to tell you in a very simple way, and this is the duodenum will tell the stomach that I am full and I'm not accepting any other load. Please wait until the time that this load that I have is passed to the other part. Or presence of any erythration from the acid from the food content. For example, when the duodenal space is acidic, this acid environment will stimulate a reflex that inhibit the contraction. And this is again the duodenogastric reflex or enterogastric reflex. Osmolarity of chymus, acidity of chymus. These are reflexes that I told you before in other session that these are nervous reflexes. There are some reflexes that are generated by endocrine system, enteroendocrine system. For example, the duodenum that is stretched, the duodenum that is irritated, will be releasing some hormones such as cholecystokinin, secretin, and you know that cholecystokinin and even gastric inhibitory peptide, and you know that these hormones will return to the gastric mucosa and gastric muscle and inhibit its contraction. And also, I am not going to open this chapter, but also inhibit the gastric secretions. But here I'm just talking about the emptying and stomach contraction. But you should know that cholecystokinin, secretin, and gastric inhibitor, and several other factors are regulating the contractility of a stomach, as I told you. These all factors show that gastric motility or stomach emptying is under the control, that some control factor are inside the stomach, some are outside the stomach, such as the duodenum, and some are in the brain. And you know that our brain also affect the gastric motility. And I will tell you about the regulation of gastric secretion in other section, that how cephalic phase also affect the stomach function. But for here, you should know that gastric emptying, stomach emptying, is very completely dependent on the factors inside the stomach and outside in the duodenum, and these are nervous and endocrine mechanism. Now that food enter the small intestine, Now it is time for those typical function, typical movement that I told you before. One of the movement that we have in the small intestine and then in the large intestine is the mixing movement. And I told you that mixing movement help the food content to be completely mixed with each other. And you see this contraction that is happening between the food content, it move the food in two direction, and then another contraction in other two direction, and this will repeat and again, and completely mix the food content. But on the other hand, we have and you see that this mixing movement, I told you that some are regularly spaced. You see that the space are completely regulated. Some are isolated, just there is one movement. Some are irregularly spaced. You see that the distance are different, and some are weak but regularly spaced. All these movements try to mix the food with the enzyme that are secreted and added to the intestine, and make the best digestion to happen. And also we have the peristaltic movement or propulsive movement that I told you. Propulsive movement move from one point and move to the distal part. This recording that you can see is showing the small intestine movement, and as you see, in one part it is inhibited, in another part is contraction, and then another contraction that is happening. This is another figure. For example, you see this is proximal duodenum. Contraction force is increased in this point, and then after some minute, this contraction force move forward to a little distal part, in the distal duodenum, and then in the jejunum, and then to the ileum. This show that movement are completely regulated and in one direction. The movement that we have in the small intestine is in one direction, from the proximal part to the, or from mouth end to the anus end. And these are regulated by several, again, neuronal factor and endocrine factor, and local mechanism, and also nervous mechanism and endocrine mechanism. In the small intestine also we have one type of movement that is happening during the time that we do not have any food intake, or between the meals. It is somehow like the hunger contraction that I told you. And these are named as migrating motor complex movement, MMC. The MMC movements help the gastrointestinal system, from the stomach to the intestine and in the large intestine, to be little, I can say that, completely emptied. If any remaining of the food still remain in one part, this help to wash it out and send all the content into the distal part. And as you see, there are some waves of movement that we have in the small intestine. These are the contraction that happening, and then relaxation, and then another phase of contraction and strong contraction again. And this will happen several times over time. This MMC movement is not because of the presence of the food. It happened to clean the content of the gastrointestinal system. And one hormone that is involved in this process is named as motilin. This hormone is involved in the regulation of MMCs. Okay, let me wrap up this part. In the small intestine, you can see that from the duodenum, that food is entering the duodenum. Food will move forward, and by peristaltis movement and mixing movement all the time. It will be mixed together, and by step move forward, and step by step it will be turning down and up and mix with the enzymes and allow the gastric intestine mucosa to have content with the food content, and this content therefore is able to be absorbed or digested and then absorbed. In the next sections that I am talking about, the absorption and digestion, you will understand how it is important for the food content to be mixed with the food, with the enzyme, to move from one side to another side, and make the enough contact between the mucosa, intestine mucosa, and the food content. When the food reach the final part of the small intestine, I can say that the most nutrient are absorbed. The most valuable factor that we have in the food are absorbed, except some ions and water that remain, and this fluid that contain just fluid and electrolytes will enter large intestine. In the large intestine, again, the release and emptying of the small intestine into large intestine is regulated by another sphincter, ileocecal sphincter. Ileocecal sphincter is the place that a small intestine is emptying into large intestine, and again it is completely contracted all the time except the time that food remaining reach this area. Ileocecal sphincter again has a function like the pyloric contraction. It releases the content of the small intestine into large intestine in a regulated way, not continuous way. And again, the large intestine, particularly ascending colon, regulate the amount of the movement in the ileum. I mean, large intestine is talking with the ileum how much of movement you should have, how much of emptying you should have. And again, there are several endocrine and neuronal mechanisms to generate these reflexes that are started from colon to the ileum. And for this reason, we say, I told you before that we have some reflexes named as colono-ileal reflexes. It starts from colon to the ileum. And in the ileum, we have somehow the emptying of the content like that we had in the stomach because of the presence of the ileocecal. When the food content enter the colon, it is completely fluid. But when it move forward, gradually water and electrolyte will be absorbed, and therefore it start to become semi-fluid, and then semi-solid and solid, and finally a solid remaining, that is a stool, will be excreted from the body, or will be rejected from the body by the rectum. When I'm telling you that the mixing movement in the small intestine and large intestine is very important, I refer you to the structure of the mucus of the intestine. And you remember I told you that these villi and these villi that increase the surface area of the small intestine generate a very, very appropriate situation to have best contact with the food. And when food is turning down and up and it is mixing all the time, this type of contact will be potentiated, and therefore it will be better for the absorption. And as you see, there are several capillaries and veins and also lymphatic system to be able to absorb the absorbable content. This is showing the ileocecal sphincter that I told you, and I told you that this is involving the regulation of the ileal emptying into the duodenum. I told you, for example, the presence of pressure that stretched the colon, the presence of any erythration, chemical erythration that we have in the colon will inhibit ileal emptying. And when the content of ileum is completely fluid, it will be emptied a little faster than when it is less fluid. And again, this sphincter make a regulatory arm for us to regulate the movement, regulate the emptying of the content. What about the large intestine? In the large intestine, the main type of movement that we have is the mixing movement. Sometimes they are named because they are large movement that generate some bag-shaped structure in this large intestine. They are named as hastrations. There are some propulsive movement, that this propulsive movement is mainly mass movement, and again, gastrocolic, duodenocolic. There are some reflexes that affect the duodenum. For example, you remember I told you about the breakfast reflex. I told you that after breakfast, gastric mucosa and when we have a stomach stretching, a stomach will send a signal to the colon and stimulate its movement. It is named as gastrocolic. Or when the duodenum is stretched, in advance, it sends a signal to the colon that stimulates its contraction. If I want to say in a simplified way, I can say that the duodenum sends a signal in advance to the colon that a content is coming to you very soon. Please be ready. Therefore, the colon should increase its movement and try to empty itself and be ready for the content that is coming. The same is also true for the gastrocolic reflex. In this figure, you can see that because of these movements, when we have a fluid in the area near to the ileocecal valve, in this area, the content is completely fluid. Then it will become semi-fluid. In the transverse colon, it will become mush-like, then semi-mush. In the ascending colon, it will become semi-solid, and in the rectum, it is completely solid. And you know that the movement that we have in the colon, if it is very fast, it do not allow enough absorption of water and electrolyte. Therefore, this fluid will reach the rectum, and therefore diarrhea will be resulted. Sometimes that this movement is inhibited, for example, because of the drugs or because of the disease state, because these movements are poor. Therefore, there is enough time and larger volume of water will be absorbed. This will generate a process that causes constipation. Let me bring you one example. You know that in the thyroid hormones are involved in the normal motor function of the colon and in the gastrointestinal system, and therefore those who have thyroid dysfunction will have poor motility in the colon, and it will cause constipation. or those who use some drugs such as morphine. Morphine again is against this movement. And one reason that addicted person have complaining about all the time, they are complaining about the constipation, is because of the inhibited, or not, I cannot say incomplete inhibition, but low stage movement that we have in the colon, and it causes constipation. And on the other hand, I told you that excess movement, excess motility do not allow enough absorption and cause diarrhea or loose fecus. Finally, the final movement that we have in the gastrointestinal system is the defecation reflex. Defecation reflex starts when the rectum area is filled with the content. I told you that this part is completely, content is completely or semi-completely solid. When this area is stretched, rectum area is stretched, or a part of the sigmoid area or descending colon is being stretched, send a signal to the parasympathetic nervous system, and send a signal to the parasympathetic nucleus in the pelvic nerve. And this will start a reflex that is started from the spinal cord. And what is the response of this reflex? It stimulates the contractility of the smooth muscle in the descending colon, sigmoid colon, and rectum. I mean that the pressure is increased and the pressure stimulates the contraction. And this starts another one cycle of positive feedback. Therefore, this starts. And at the same time, we have two types of sphincter in the anus. One sphincter is a smooth muscle, and it is completely involuntary. Therefore, under this reflex, not only the colon is contracting, but also the internal sphincter also will be relaxed. But at the same time, we have another. This is the only difference that we have with other sphincter in the gastrointestinal system. That anal sphincter has a part that is external anal sphincter, and this part is generated by the striated muscles. Therefore, they are voluntary, and a person is able to contract it voluntarily and prevent defecation to happen. When the situation is enough, when the situation is appropriate, these contractility of these muscle could be relaxed intentionally, and then the reflex that is generated by the spinal cord push the content downward, and therefore defecation will happen. Therefore, defecation has a voluntary part, and this allow a person to calculate the time or to consider the time and do not defecate everywhere, just in appropriate situation. And you know that in childs, this process is not learned yet. Therefore, they are not able to control their defecation. Or those who have a spinal cord injury, because as you see in this figure, a signal from this nucleus is being sent to the conscious cortex. They are not able to receive this information. Therefore, external anal reflex is relaxed all the time. Every time that internal reflex is relaxed, defecation will happen. And this is a problem that all the time we have, or those injured patient or those that have a spinal injury have, and they have no choice to control their defecation. But we know that even in these persons or in the child, after eating food, this defecation may happen, and this is there is higher chance for defecation to happen. By this slide and this movement that I told you, the motor function of the gastrointestinal system was covered, and I told you about all the aspects of the motor function of gastrointestinal system. There was lots of fact to talk about the motor function, regulation of motor function, but for your time and for your curriculum, this is enough. And you know that the most part of these topics are coming from the Guyton and Hall and a little from Ben and Levy. Your reference for your exam is my words and those topics and those points that I told you in the class. And now that we have a concept about the motor function of the gastrointestinal system, now we are able to discuss another function. And this another function that I will start to discuss about in the next section is secretory function of the gastrointestinal system. Until that time that we are going to discuss about the secretory function of the GI system. Have a good time and take care. Thank you.